Hello everyone! My name is Joanne Roxanne and welcome to my channel. For those of you who are new to my channel, I'm currently doing a series of videos regarding OET preparation. In my previous video, I explained what OET is, how it differs from IELTS, who recognizes OET, what the acceptable grades are, and general tips to help you achieve a high score in your first attempt. And for today's video, I am going to cover everything you need to know about the OET Listening Subtest. But first, I'd like to thank OET for letting me use in this video the official OET sample tests, which you can see at www.occupationalenglishTest.org. Thank you, OET! So the OET Listening Subtest is divided into 3 parts, and there are a total of 42 questions. It will run for about 40 minutes and you will only hear each recording once. Now let's talk about each part in details. Firstly, Part A, you will be listening to 2 conversations, and in each conversation you will hear a medical professional talking to a patient. So it could be a doctor talking to a patient or a nurse talking to a patient. So there will be 12 questions in each conversation, so a total of 24 for the 2 conversations. And they are fill in the blanks kind of questions, like this. So here are the tips and strategies that I could share with you. Number 1, the answers would come from the patient. Remember that it is a conversation between a medical professional and the patient, and you will be hearing the answers from the patient, not from the medical professional. Second tip is, before they play the conversation, you will have 30 seconds to read the questions. So within that 30 seconds, what you can do is to read and predict what kind of words you need. So what do I mean by that? Let's see number 1. Back injury sustained lifting. So I think this will be an object, a heavy object, for example. Number 2, pain located in. So most probably this would be a body part. Number 3, pain described as an adjective, maybe excruciating, sharp. Number 4, mentions inability to, so it could be a verb, maybe sleep. Number 5, blank sensation. So I think this would be an adjective ending in ing, maybe tingling. And number 6, occupation that involves travel or manual work. So it's a noun, a job. Listen for that. Number 7, application of blank that provided some relief. So this could be a hot compress or a pain relief cream, something that you are applying. Number 8, referrals. So this is a kind of a specialist. And number 9 to 11 are all under further treatment. So I think the 3 words or phrases could be different kinds of treatment. In number 12, sciatica probably related to. So this could be another kind of disease or illness. Remember, you have to read and predict fast as you only have 30 seconds to do this. Another tip is, you have to look for synonymous language, because not all phrases in the questions are exactly the same ones that you will be listening to. For example, look at number 5, then listen to the recording.
Sometimes I'd have, well, sort of tingling feeling in my calves as well.
Right.
In the question paper, it says sensation, but what you've heard is feeling. So not the same words, but synonymous. Let's see another example. Look at number 10 and listen to the recording.
At one point, I even considered acupuncture, but by then, the other things were beginning to take effect and the symptoms were subsiding, so I gave it a miss.
So in the question paper, it says, decided not to try, but in the recording, you've heard, gave it a miss. So different phrases, but synonymous language. And lastly, if you get lost, use the titles or the completed notes for reference, like this.
OK, so how was this treated?
Well, in the first instance, I was given painkillers, obviously. Ibuprofen, as far as I can remember.
Right.
So you've heard the physiotherapist asking the patient how was he treated, and the patient answering that he was given painkillers. So you know that we are now under the title of initial treatment and that he already said the part about NSAIDs. So you know now that the next part that you need to listen to is the part about application of something. Now let's take a look at another example.
So I was referred to a sports injury specialist, of all things. And he did a number of things that did seem to ease things a little, like working on my spine and lower legs. Oh, and he gave me a set of exercises to do at home.
I see.
So you've heard the patient talking about his referral to a sports injury specialist. So now you know that the next part that you will be listening to is about his further treatments. Now let's do a mock test. Get a pen and paper so you can write your answers. Remember the strategies. The answers would come from the patient. Use the 30 seconds before playing the conversation to read and predict the kind of words that you need. Look for synonymous language. And lastly, use the titles or the completed notes for reference if you get lost.
Extract 2, questions 13 to 24. You hear a consultant dermatologist talking to a patient called Jake Ventor. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Jake Ventor? Please come in and take a seat.
Thanks.
OK, now I understand from your GP that you've got a problem with your hand?
Yes, I went to see a couple of weeks ago because of a sore on my left hand. I've had it for years, but not all the while. You know, it appears, then it gets better, then it comes back. It's here on the palm. It's almost gone now. But she wasn't sure what it was, so she said I'd better see a dermatologist. She took a photo. Did you get that?
I did, yes. So tell me about the condition, how it feels and...
Well, I always know when I'm going to get it because I have this itching beforehand.
Right.
I wake up at night wanting to scratch the area, though I try to stop myself.
Good.
Then a few hours later, I get one or two little blisters and they gradually get bigger and join up into one big one. It all feels a bit hot and the skin around it goes red. When I showed this to the doctor, she used the word chaotic to describe it. Anyway, it gradually dries up and I get a scab. Then after about 2 weeks, that falls off and there's just a little red patch, like you can see now.
OK.
I've been getting it for years. I actually got it the first time when I was in China in the 1990s. I had a job there for a couple of years before I came back here. That first time, I also had a similar sore on my chest, but that's never come back. But the one on my hand, that comes back every year or so, but never in exactly the same place. I thought it had sorted itself out because I didn't get it for a couple of years, but then it came back.
Right.
So there's no pattern. It's not getting more frequent or anything, and it doesn't seem linked to anything in my daily life. Like, it doesn't seem to happen when I'm run down, for example, or because of anything in my diet, or if I'm under a lot of pressure at work, that kind of thing.
Okay.
So the doctor thought you needed to have a look. Also because I had a malignant melanoma on my back that was removed in 2006.
Right.
It was at quite an early stage and it hadn't got too deep.
Okay, well, that's good. Still, I'll just have a look at your back.
Mm-hmm.
Was it down here?
Yeah, that's right.
Okay. Well, yeah, that all looks absolutely fine. Well, I don't think you need to worry about anything sinister here. By the way, have you ever had cold sores?
No, never. But I did wonder if this thing on my hand was something like that. In fact, I wanted to ask you about that. There's an antiviral cream you can use, isn't there, to stop them developing? I wondered if you could prescribe me something like that.
Look, the trouble is these work well on the mouth because the skin's very thin there, but I'm afraid they won't have any effect in your case because the skin on your hand's so much thicker.
Oh, I see.
Yeah.
Well, something else that worries me is whether there's a chance of infection. Should I be covering the place up?
No, you don't need to unless there's broken skin.
Right, good.
It's fine.
And it's not actually having an impact on my quality of life or anything like that. It's something I can live with. I mean, I have done for all these years.
Okay, so really the reason you went to the doctor after all these years was just to see if there was any way we could prevent this happening.
Yeah.
Okay, well, at this stage, the best thing to do is organise a biopsy. It might be a bit uncomfortable, but it means we can rule certain things out.
Okay.
That is the end of Part A.
So here are the correct answers. And now let's go to Part B. In Part B, you will be hearing 6 short extracts, which can either be a monologue like a nurse talking or a dialogue like a nurse talking to a patient. So in each extract, there is one multiple choice question like this. So there are a total of 6 multiple choice questions for the 6 extracts. So what you need to do for Part B is, number 1, read the context and the question. So you have 15 seconds before they play the extract. So my strategy is to read the context, read the question, read the context again, and then read the question, and just really understand what is being asked. So 15 seconds before the extract is played, you have to read the context and the question twice and just understand what is being asked. So the context, you hear a nurse briefing her colleague about the patient. And the question is, what does she warn her colleague about? So you will be listening to the thing that the nurse warned her colleague about. Next is to ignore the options. If you want, you can cover the options while listening to the extract. Ignore the options while listening to the extract. If you want, you can cover them with your hand. Then while listening, keep in mind the question. Focus on the question and just listen for its answer. And then lastly, after you listen to the extract, you will now choose the answer from the options, and you have 5 seconds to do that. Now let's try it.
Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
So you have to read the context in the question twice and just really understand what is being asked. So you hear a nurse briefing her colleague about a patient. What does she warn her colleague about? You hear a nurse briefing her colleague about a patient. What does she warn her colleague about? So just focus on the question, understand the question, and then cover the options. Ignore the options. And now, while listening to the extract, keep in mind the question and listen for its answer.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Now you have 5 seconds to choose the answer, and that would be letter B. Care must be taken to prevent the patient from falling, as the nurse warned her colleague that the patient is at high risk for falls due to dizziness. Let's take a look at another example.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Read the context and question twice and understand what is being asked. You hear the manager of a care home for the elderly talking to the nursing staff. He says that errors in dispensing medication to patients usually result from. You hear the manager of a care home for the elderly talking to the nursing staff. He says that errors in dispensing medication to patients usually result from. Then cover the options, keep in mind the question, and listen for its answer.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Now you have 5 seconds to choose the answer, which is letter A, interruptions while calculating dosages. I find this strategy helpful because I do not get confused by the options and I just focus on the question while listening to the extract. Now let's do a mock test. Remember the strategies. Read the context and the question, understand what is being asked, ignore the options, keep in mind the question while listening to the extract, and then choose the answer from the options within 5 seconds.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time?
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, she endured it without a murmur.
Hmm.
I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right, well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. But you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
OK.
So here are the correct answers. So how was it? How many correct answers did you get so far? Comment below, hit the like button, and consider subscribing to my channel if you find these strategies I shared helpful. Lastly, Part C. So for Part C, you will be hearing 2 long recordings. This can be long lectures or interviews. So for each recording, there are 6 multiple choice questions. So a total of 12 multiple choice questions for the 2 recordings. So for Part C, you will have 90 seconds before they play the recording. So what you need to do in that 90 seconds is to read the questions and the options and then encircle the keywords. So unlike in Part B that you can ignore the options while listening, here in Part C you cannot really do that. So you have to read the question, read the options, and then encircle the keywords. Read the questions and the options and encircle keywords. Why does Dr. Robson regard Chagas as a neglected disease? Because of the social groups it mainly affects? Because patients often don't realize they are infected? Because its impact is severe in a relatively small number of cases? Dr. Robson says that concerns over Chagas in the USA are the result of a rise in the number of people at risk of being infected with the disease, a greater awareness of how many people there have the disease, an increased prevalence of the insect which carries the disease. Then while listening to the recording, keep in mind the question. So you might hear one of the options in the recording, but it is not really the answer that you are looking for. So you really have to understand the question, keep the question in your mind while listening. And then lastly, eliminate incorrect options. So when you listen to the recording and heard that one of the options is incorrect, you can now eliminate that. So let's practice. When you listen to the recording, listen to why Chagas is a neglected disease. Remember that you might not hear the word neglected, but you might hear a synonymous word or phrase instead. So you have to listen and read the options, listen and read, listen and read, listen and read.
Dr. Robson, what is Chagas disease, and why is it referred to as a neglected disease?
Chagas is caused by a parasite called Trypanosoma cruzi. Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase of the infection, symptoms are normally mild or absent.
Okay.
70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years, but it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders. About 7 million people worldwide are thought to have Chagas, but it attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action.
Right, I see.
The correct answer is letter A. Let me replay the recording and we'll see why the answer is letter A.
Dr. Robson, what is Chagas disease, and why is it referred to as a neglected disease?
Chagas is caused by a parasite called Trypanosoma cruzi. Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase of the infection, symptoms are normally mild or absent.
Okay.
You've heard him say option B. Patients often don't realize they're infected, but that is not why Chagas is a neglected disease. So you can now eliminate that option.
70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years, but it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders.
So he mentioned option C. He said, for the other 30%, so that would mean a relatively small number of cases, and then he said, it enters a chronic phase characterized by serious disorders, so that's synonymous to its impact is severe. But then, it is still not why Chagas is regarded as a neglected disease, so we'll have to eliminate option C.
About 7 million people worldwide are thought to have Chagas, but it attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action.
Right, I see.
And finally, he mentioned option A. He said it affects communities in Latin America, and that's the social groups. But what you've heard from him is not neglected, but he said indifference, and that is synonymous to neglected. So yeah, A is the correct answer. Let's take a look at another example. So you have to listen for the concerns over Chagas in the USA. Remember that you might not hear the word concerns, so you have to listen for synonymous words or phrase. Listen and read the options and eliminate incorrect options.
Right, I see. And are there any concerns in the USA about Chagas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
So the correct answer is option B, a greater awareness of how many people there have the disease. Let's replay the audio and let's find out why the correct option is option B.
Right, I see. And are there any concerns in the USA about Chagas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA.
He says that the insect carrying the parasite is actually endemic to the southern U.S. state. So endemic means that it is native there and there was no increased prevalence of the insect that carries the disease. Therefore, we can eliminate option C.
The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
So he said, the alarming thing though is that the large numbers of first and second generations from Latin America carry Chagas. Take note of what he said, the alarming thing, which is synonymous to concerns. So now we know that the concern is about the large number of people that carry Chagas, or in other words, people that have Chagas. So the correct option is option B.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
He said, those people won't infect others, so option A is incorrect since there is no rise in the number of people at risk of being infected. Now let's do a mock exam. Remember the strategies. 90 seconds to read the questions and options and to encircle keywords. Keep in mind your question while listening and eliminate incorrect options.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear an occupational therapist called Anna Matthews giving a presentation to a group of trainee doctors. You now have 90 seconds to read questions 37 to 42.
Hi, my name's Anna Matthews. I'm an occupational therapist working here in the hospital. In a moment, I'm going to present a case study to you to show you the type of work I do. But first, let's think about what we understand by occupational therapy and the part it plays in patients' recovery. In simple terms, therapists like me help patients of all ages to participate in the things they want or need to do through the therapeutic use of a range of recognised activities. For example, this could be helping patients who are recovering from illness or injury to regain skills and get back to work. Or it could be supporting older adults who are going through physical and cognitive changes. What I always have to keep in mind, however, is what the individual wants to achieve. I always say that a doctor's first question is, what's the matter with you? Whereas my first question is, what matters to you? Now, onto my case study. It involves a patient called Ted, a 60-year-old man whose motorbike was in collision with a car. Luckily, the accident happened at moderate speed, but he still suffered compound fractures in both legs, in one arm, and several broken ribs. When I first met him, after 2 weeks in hospital, he was physically and emotionally broken. After all, not only was his mobility in question, but much more importantly, So was his style. Doctors had told him that he might never be able to squeeze into his motorbike leathers again. So he'd given up. Imagine how he must have felt. One day, totally independent, and the next, suddenly unable to do things anymore. Ted showed little interest in receiving treatment. Some colleagues at the hospital took the view that if he stubbornly refused to help himself, there was little they could do. It was his right, they said. But I didn't agree. Since Ted couldn't use his legs or right arm, I made sure we concentrated on what he could do with his left hand. For example, I worked on strategies to help him dress himself and things like that. We even worked on fine motor skills, like writing with his left hand. I wanted to make sure that even if he didn't ever regain use of his right arm, I could at least get him to function by whatever other means were open to him. So, how did my therapy help? Well, I worked with Ted on his hands, putting playing cards on a table and getting him to pick one up, which he couldn't do. But he then resorted to sliding the cards off the table and picking them up that way, finding a way of compensating for what he couldn't do. He'd become upset about what he felt was his lack of progress. Relearning to do things you used to do with ease can be frustrating. But in time, I got him to see that if he didn't work with me, then he'd stay as he was for the rest of his life. That was a big motivating factor. Ted had therapy for 8 months, and he had his ups and downs. For example, the day when he finally had the plaster casts removed from his legs. He built it up in his mind into a great step towards independence. In reality, of course, it wasn't. He was still unable to stand because he'd lost a lot of strength, and the doctors were still predicting he'd remain in a wheelchair. Although I'd warned him about all this, that moment still came as a big disappointment. But strangely, when something like that happens, it can be a turning point. Like many patients, Ted became even more determined to regain mobility after that. Anyway, you'll be delighted to know that Ted's story had a happy ending. He's now back at home and back at work too. Learning to walk again took every ounce of energy he had. But patients like Ted, with that fighting spirit, go from strength to strength after discharge. That's where the support of family can be invaluable. As long as they don't inhibit the patient by warning them of potential dangers at every turn. But patients like Ted tend to take charge of their own ongoing recovery, gym membership, therapy regime, that kind of thing. Seeing that gives me a real sense of pride in the work I do and the difference it can make to people.
Here's the answer key. So how was it? Did you get a good score? Comment below your score and if this strategies helped you. But remember, you have to practice, practice, and practice. So for the next video of my OET preparation series, I'm going to cover everything you need to know about the reading subtest. So make sure you are subscribed so you'll be notified when my next video is up. Thank you so much! When you came into my troubles all